Yeah, we actually met Ian when he was just an infant, actually. He was in the cardiac intensive care unit at the time, very unwell. Ian had a dilated cardiomyopathy, which basically means that the heart muscle became weak. And so a lot of those children actually experience what's called heart failure, where their heart can't keep up with the demands of their body to do day-to-day activities. Ian received very aggressive medicines in the intensive care unit that were by continuous IV to try to help his heart as much as possible. But ultimately, we weren't able to come off those medications, so he required a heart transplant. In Ian's situation, when you get evaluated for heart transplantation, you meet hundreds of people. You don't only meet the heart transplant team, but you meet all the individuals that work in the ICU, on the regular inpatient care unit, pharmacy, everyone, physical therapy, occupational therapy. It's a huge team of individuals. The good news is the way we have our team formulated, it's a continuum of care. They meet the same people before the transplant that would take care of them after the transplant, which is often very helpful to the families. I think all these families become part of our family, and that's what's so nice for us. It's not just physician or nurse to patient's family. It's actually, they do become part of our family, and we try to empathize and sympathize with them along the way, and their ups and downs become our ups and downs, and vice versa. Every time Ian comes to the clinic, it's an exciting time for us. He's full of energy, he's a lovable child, and we really enjoy their family. They're really some of the nicest people I've ever met. Very energetic, very dedicated to not only his care, but dedicated to the care of other patients that we've had that they don't even know. The mother has made gift bags for the families, and it's extremely helpful. And they put food in there and parking tokens and just things that kind of get you through your day-to-day through this very challenging process. We ask families often when they're going to go through a similar process, do they want to talk to somebody that's been through it? And when families say yes, we generally ask them to call the Sanchez family. That's the thing about transplant is you have to find as much support as you can from so many individuals. So it's not just the staff, it's actually the other families that have been through the process. And to be successful, that's the type of program you need to have, where it's extremely family-centered. And because of that, that makes a huge impact on, I think, our patients' outcomes. We are recognized not only regionally but across the country for our quality of care, and we actually have been designated as a center of excellence with Cigna. We're the only pediatric heart transplant program in Ohio that has received that type of designation. Our program at NationwideChildren's not only takes care of infants but all the way through adulthood. And even people that have been transplanted maybe as infants, as they reach adulthood, we would certainly be the team to take care of them. That's not always the case at all children's hospitals because of age limits, but we're a unique program in that we have subspecialists in adult congenital heart disease and subspecialists in all areas of cardiology that also deal with adult issues. That's extremely important because as people transition their care from childhood to adulthood and actually leave to another center, sometimes things change in the care that can affect their overall outcome. And so this is a nice way to just say you're with us the whole way. And I think it's been helpful for families and also reassuring.